Hello guys, welcome to my YouTube channel. My name is David Okuche. I'm a final year medical student, University of Jos, and in this video I'll be sharing with you step-by-step guide on how to pass your pediatric exam. In this video, I will use University of Jos as a prototype to how the posting is and how the preparation for the exam should be. So in University of Jos, you have an 8 weeks posting, and within that 8 weeks you'll be required to move from one unit to another. Doing SCBU, like special care baby unit, is a must, and then it's done for 2 weeks. And then emergency pediatric unit or emergency room for pediatrics is very, very important also. So it's also compulsory, and then you'll be required to do other units. The way we did it was two weeks, but I'm hearing that they are going to be making it one week now, so that one can be able to rotate through different units. But usually you are going to rotate within like 2 units in a 1 month period. Then the remaining 1 month you do SCBU and EPU, depending on how the arrangement comes. So I'll be looking down at what I've written so that I can properly share with you. The reading strategy I used during my time was to read at least a system per week. So it's 8 weeks, and then so for example, now the first week I'll do respiratory pediatrics, and then second week I will do like GIT. So that was how I was going over it system by system, and at the end of the day I was able to cover all the slides for that course. So if you can implement or apply this method for yourself, it's really going to help you. And then one other thing you need to do is to answer a lot of past questions. Like my preparation for the exam, in fact, like as I was going for the exam that day, I had like about 5-6 years of past questions in my head ready for that exam, that I practiced, like written down past question. Why is this the answer? Why is this not the answer? So I actually did that. So practice a lot of past question, and it is going to really help. So another point is to have a discussion group. Start early. Like during my time, I started the group discussion very early with my mates, and we're able to cover ground. We just prepared a list of things we wanted to achieve at the end of that period, and everybody were just working towards it. To meet late into the night, do several things which I'm going to explain later. So another thing you need to do is to practice examinations, like pediatric examination. You have to know how to examine all the systems: cardiovascular, respiratory, name them, all the system, abdominal examination, neonatal resuscitation, how to examine for pallor. In pediatric, there are just little things that they just want you to know regarding examination. You have to know how to check the age of a patient, to estimate the age of the patient, developmental milestone. All those things you are expected to know it. So do it. There are things you can easily forget, so you have to do it every now and then. You can use your pillow for chest examination, for abdominal examination, for CNS examination is very, very important in pediatrics. You have to know CNS examination like at the tip of your fingers. So then there's also instruments. You have to know like major instruments, like instrumentation now in pediatrics. In pediatrics, they use a lot of instruments, ambu bag, solo set, and all of that. You have to just know it very, very well. There is a PDF. Maybe I will drop the link at on the description below, so that you can see, like, there are pediatric instruments that you just need to know. So another thing you need to know is, for this exam, is pediatric emergencies. They are common things that occur commonly, as they will say. So there are topics they will teach you about pediatric emergency, how to manage emergencies. Like when a child come with like hypoglycemia, what do you do? There are ways you correct hypoglycemia and all of that. So you have to know if a child is dehydrated, how do you correct the dehydration? Like, okay, I just remember something now. In pediatrics, but you have to be very detailed. Like almost every drug you give, you have to remember meals per kg. So what I did was to just know the basic ones that you know. Okay, this one you have to just know the figures. So try as much as possible to remember the common ones. And then in pediatrics, don't joke with their logbooks. Don't joke with logbook. We had an experience in my class where almost like majority of the class were almost disqualified. So don't joke with your logbook. Keep your logbook safe. We had several of our colleagues that misplaced their logbook during the posting. So please just keep your logbook safe. Make sure you go for rounds. Make sure you go to EPU and get those logbooks signed. They are very, very important. One very important thing that can help you pass this exam is clerking and presenting. Clerking and present. You have to clerk and present a lot of patients. It will help you to know a lot of cases. It will help you to be organized. It will subject you to, like, okay, exam conditions. So it's really, really, really going to help. So another thing you need to do is to attend tutorials. There are going to be a lot of tutorials that will be done during that period. There is a schedule for the tutorial. Make sure you attend every of the tutorial, and it's going to help you. There is usually lecturers that come to teach during this tutorial period, so it's very important you go. So what material do you need to read for this exam? Okay, I actually would recommend you reading textbook, standard textbook, but the posting is short that reading standard textbook, you may not really be able to finish before the end of the posting. So what you do is to use the guide Paediatrics. So that is what I used. I read the book from back to back several times. That I made the book like to sink into me. So that was what I did, and I also read almost every slide or every lecture slide. I read it. So, and it was very good. So I would recommend using the guide and also reading their slide. So at the end of the posting, you'll be required to write a test. Like during our time, we wrote a test at the beginning of the posting and also at the end of the posting. So how do you prepare for the test? My advice would be that you should, during the posting bar, you should really focus on passing the test, because in medical school, one of the most important things is passing your test. Once you pass your test, you will not like have any, like, you know be panicking for the exam. You know you have a very high chance of passing. I think your exam is going to be OSCE, so there's really nothing to worry about. Just focus on the test, pass the test very well by reading, practicing past questions, and I know you do well in the test. So the exam now, you have to just really practice all those examination, clerking, and so many other things that you need to do. So this is just like a little guide on how you can be able to pass your pediatrics once. I don't want the video to be too long, but I will leave the link to some of the materials I mentioned below so that it can be of help to you. So if you like this video, please click the subscribe button, like, share this video with your friends. Thank you very much.